Pulmonary hypertension and cor pulmonale. Pulmonary hypertension is an abnormally high blood pressure in the arteries of the lungs. It can occur as a primary disease or as a secondary complication from an existing disease. Primary pulmonary hypertension is a severe and progressive disease. It is characterized by an increase in pulmonary arterial pressure. It is common in women than men and could be fatal in a few years if left untreated. Secondary pulmonary hypertension can develop as a result of a cardiac or pulmonary diseases or both. The origin of primary pulmonary hypertension is unknown. However, it was discovered that the key mechanism involved in this disorder is a deficient release of vasodilator mediators from the pulmonary epithelium, with a resulting cascade of injury. The three elements that combine to cause the increased vascular resistance are vasoconstriction, remodeling of the walls of the pulmonary vessels, and thrombosis. Secondary pulmonary hypertension occurs when a primary disease causes a chronic increase in pulmonary artery pressures. Such diseases included congenital heart defects, other cardiopulmonary disorders, or connective tissue disorders. Classic symptoms of pulmonary hypertension are dyspnea on exertion and fatigue, exertional chest pain, systolic ejection murmur, dizziness, and exertional syncope are the other symptoms. These symptoms are related to the inability of the heart to increase cardiac output in response to the increased oxygen demand. Diagnostic evaluation for pulmonary hypertension includes cardiac catheterization and echocardiogram. Other tests include ECG, chest X-ray, and pulmonary function test. Early recognition of pulmonary hypertension is essential to interrupt the progression of the disease. Although there is no cure for this disease, treatment can relieve symptoms and increase quality of life. Traditional treatments consist of diuretic therapy, oxygen therapy, anticoagulation, and calcium channel blockers. In the past decade, 6 new drugs have been approved for the treatment of primary pulmonary hypertension. All of them promote vasodilation of the pulmonary blood vessels, reduce right ventricular overload, and reverse remodeling. For those who do not respond to drug therapy, surgical intervention or lung transplantation is an option. Treatment for secondary pulmonary hypertension consists mainly of treating the underlying primary disorder. Nursing consideration for pulmonary hypertension includes instructions to the patient to balance rest and activity, avoid overexertion, and avoid isometric exercise. Inform the patient regarding their medication and to follow up on laboratory testing for their anticoagulant therapy. Cor pulmonale is the enlargement of the right ventricle of the heart secondary to diseases of the lungs, thorax, or pulmonary circulation. It develops when an occluded vessel impairs the heart's ability to generate enough pressure. As mentioned earlier, this increase in pulmonary vascular pressure progresses to pulmonary hypertension, which increases cardiac workload resulting in hypertrophy and dilation of the right ventricle. The common cause of cor pulmonale is COPD. However, almost any disorder that affects the respiratory system can cause cor pulmonale. It may be present with or without cardiac failure, and pulmonary hypertension is always a precursor. Clinical manifestations are subtle and often masked by the symptoms of the pulmonary condition. Symptoms include dyspnea on exertion, lethargy, fatigue, tachypnea, orthopnea, and distended jugular vein. A detailed history and physical examination is needed in the diagnostic evaluation of cor pulmonale along with chest X-ray. Arterial blood gases, serum and electrolytes, and monitoring with ECG and oxygen saturation are needed as well. The primary management of cor pulmonale is directed at treating the underlying pulmonary problem. Long-term low-flow oxygen therapy will correct hypoxemia, that will reduce vasoconstriction and reduce pulmonary hypertension. If fluid and acid-base imbalances are present, they should be corrected. Diuretics and low-sodium diets will help decrease the plasma volume and reduce workload of the heart. Bronchodilator therapy is needed if underlying respiratory problem is due to obstructive disorder. Other treatments include bed rest, vasodilator therapy, calcium channel blockers, prostaglandins, and anticoagulants. Nursing considerations for cor pulmonale includes offering of small frequent meals and restriction of fluid intake. Inform patient regarding their medication and advise them to avoid exposure to people with infection or influenza to prevent further complications. This concludes my presentation about pulmonary hypertension and cor pulmonale.